Every morning, without thinking about it, you make a decision that either protects your kidneys or quietly works against them. You do not make it consciously. You do not make it with any awareness of what is happening inside your body at that precise moment. You make it out of habit, out of routine, out of the simple, comfortable rhythm of a morning that has looked the same for years. And for most people over 60, that decision, made in the first 10 minutes after waking, is one of the most consequential choices their kidneys will face all day. Here is what I need you to understand before this video is over. The morning is not just the start of your day. For your kidneys, it is the most demanding, most vulnerable, most high-pressure window of the entire 24 hours. Your blood is at its thickest. The waste products your kidneys need to filter are at their highest concentration. And the filtration system itself is running on empty after 7 or 8 hours without a single drop of fluid. And yet the first thing most people give their kidneys in that window is a diuretic, a substance that tells the body to expel more fluid, a substance that, rather than relieving the morning stress on the kidneys, extends it. My name is Dr. Favor Clinton. I have over 10 years of clinical experience, and kidney disease is one of the conditions I have spent the most time studying, treating, and trying to prevent. I have seen what happens to kidneys that are consistently deprived of proper morning hydration over years and decades. And I have seen what happens when people make one simple, inexpensive change to what they drink first thing in the morning. Today, I am going to tell you about the one morning drink that carries the most documented, most specific, most clinically supported benefit for kidney protection. Not a supplement, not a prescription. Something you can prepare in your own kitchen in under 3 minutes for a few cents starting tomorrow morning. And I am going to explain exactly why it works, because a recommendation without the science behind it is just a suggestion, and suggestions do not change behavior. Understanding does. So stay with me. To understand why this one drink matters so much, you first need to understand what is happening inside your kidneys during the hours before you wake up. While you sleep, your body goes without fluid for 7, 8, sometimes 9 hours. Your kidneys do not sleep. They continue working throughout the night, filtering your blood, regulating your mineral balance, managing your blood pressure. But without incoming fluid to work with, they have to adapt. And the way they adapt is by concentrating your urine more and more aggressively. As the night progresses, your urine becomes more concentrated. Your blood becomes more viscous, thicker, harder to pump and filter. The concentration of waste products in your bloodstream, including urea, creatinine, uric acid, and calcium oxalate compounds, rises steadily. By the time your alarm goes off, your kidneys are operating under what I describe to my patients as the morning stress window. It is the period when filtration demand is at its peak, fluid availability is at its lowest, and the risk of kidney tubule damage from concentrated urine is at its highest for the entire day. Now add to this a second factor that most people are unaware of. After 60, the small filtering channels inside the kidney, called tubules, become less efficient. They require optimal fluid conditions to function properly. Concentrated, acidic, waste-heavy urine moving through aging tubular tissue is one of the primary mechanisms through which kidney stones form, through which tubular inflammation accumulates, and through which the estimated glomerular filtration rate, the key measure of kidney health, declines year by year. Think of it this way. A healthy river flows freely. It carries sediment and waste downstream. It keeps its banks clean. A river in drought slows down. It concentrates everything it carries. It deposits sediment on its bed. Over time, it damages the very structures it runs through. Your kidneys every morning are either that healthy flowing river or that drought-stressed one. And what you drink first determines which one they are. There is also a third factor, one that is specifically relevant to kidney stone formation and early tubular damage. During the overnight hours, your urine becomes not just more concentrated, but more acidic. The pH of your urine drops. An acidic, concentrated urine is the exact environment in which calcium oxalate crystals, the building blocks of the most common type of kidney stone, form most readily. This is the environment your kidneys are navigating every single morning. And the drink I am about to describe addresses all three of these factors simultaneously. Not one of them, all three. I want to tell you about a patient I will call Henrietta. Henrietta was 67 years old when she was referred to me by her primary care physician after a routine blood panel flagged an elevated creatinine level. She was a retired secondary school administrator, active, engaged, someone who paid attention to her health and had done so for most of her adult life. What struck me most about Henrietta's case was how unremarkable her history appeared on the surface. No diabetes, blood pressure slightly elevated but managed with a single low-dose medication. No family history of kidney disease, no history of urinary tract infections. And yet her eGFR had fallen to 51 over the preceding 18 months, a decline that was faster than simple aging should account for. When I sat with her and went through her daily routine in detail, I asked the question I ask every patient at their first appointment. What is the first thing you drink every morning, from the moment your feet hit the floor until you sit down for breakfast? Her answer was immediate: coffee, 2 large cups, black, then nothing else to drink until mid-morning, when she might have a glass of water with her mid-morning medications. On most days, by noon, she had consumed fewer than 8 ounces of water. The rest of her fluid intake was coffee, afternoon tea with milk, and an occasional juice with dinner. Henrietta was starting every single day in a significant state of dehydration. Her kidneys were beginning each morning already under peak stress and receiving nothing that would relieve that stress for the first 2 to 3 hours of the day. The coffee, a mild diuretic, was actively extending the morning stress window rather than closing it. We made one specific change. One drink added to the very beginning of her morning, before anything else. Before the coffee, before the medications, before breakfast. Within 4 months, her creatinine had stabilized. Within 8 months, her eGFR had improved modestly but measurably, from 51 to 57. Not a dramatic reversal. Kidney function rarely reverses dramatically, but a clear and meaningful change in direction. She came back to see me at that 8-month mark and said something I think about often. She said, "I've been making my morning coffee for 30 years, and nobody ever told me that what I put in my body before that coffee could be this important." That is the gap, and today I am closing it for you. The morning drink with the most specific, most well-documented, most mechanistically understood benefit for kidney health is warm lemon water. Half a fresh lemon squeezed into a glass of warm water, consumed before anything else every morning. I know what some of you are thinking. You have heard about lemon water before. It has been mentioned in wellness articles and lifestyle blogs and morning routine videos for years. But the reason most people dismiss it, or try it for a week and stop, is that nobody has ever explained the actual science behind why it works specifically for the kidneys. Without that understanding, it feels optional. With it, it becomes something entirely different. Let me give you that understanding now. Lemon juice is the single highest natural dietary source of citrate among all citrus fruits. And citrate performs a function inside your kidneys that is both specific and extraordinary. Here is what happens without enough citrate in your urine. The waste products your kidneys are filtering, particularly calcium and oxalate compounds, begin to interact with each other in the concentrated, acidic urine of the morning. They cluster. They form microcrystals. Those microcrystals grow. And as they grow, they grind against the delicate inner walls of your kidney tubules, causing microscopic inflammation and scarring. Over years, that cumulative scarring contributes directly to declining kidney function, and in some people, those crystals grow large enough to become kidney stones. Here is what happens when citrate is present. Citrate binds directly to calcium ions in the urine. It forms a stable compound that prevents the calcium from clustering with oxalate. The crystal formation process, called nucleation, cannot begin. The inflammation does not start. The tubular damage does not accumulate. The stones do not form. This is not a theory. This is documented chemistry that has been studied in clinical settings for decades. A study from Duke University Medical Center and replicated in subsequent clinical trials published in peer-reviewed nephrology journals found that regular lemon juice supplementation significantly increased urinary citrate levels and reduced kidney stone recurrence in patients with a history of calcium oxalate stones. The National Kidney Foundation formally recommends lemon water as a preventative measure for stone-prone individuals. And here is the timing piece that makes the morning specifically the most important window for this. Your urine is most concentrated and most acidic in the early morning. That is when the conditions for crystal formation are at their most favorable. That is precisely when citrate's protective effect is most urgently needed. Drinking warm lemon water first thing places citrate into your urinary system at the exact moment it can do the most good. Despite being acidic in the glass, lemon juice produces an alkalizing effect in the body once it is metabolized. The citric acid in lemon juice is broken down during digestion, and the byproducts shift your body's internal chemistry in an alkaline direction. This is relevant to kidney health in a specific and important way. Kidney stones made of uric acid, which are common in people with gout, high-protein diets, or certain metabolic conditions, form almost exclusively in acidic urine. Uric acid dissolves readily in alkaline urine and becomes insoluble and stone-forming in acidic urine. By gently raising the pH of your urine, warm lemon water makes the environment significantly less hospitable to uric acid crystal formation. For people who have been told they are at risk of kidney stones or who have a history of gout, this alkalizing effect is not a minor benefit. It is a direct, documented, daily intervention against one of the most preventable forms of kidney damage. The third mechanism is perhaps the most straightforward but deserves its own explanation. Warm water is absorbed by the gastrointestinal tract faster than cold water. When you drink a glass of warm water in the morning, rehydration begins within minutes. Blood viscosity begins to drop. The concentration of waste products in your bloodstream begins to dilute. The kidney's filtration workload begins to fall. This matters because of what we discussed earlier about the morning stress window. Every minute that your kidneys spend filtering thick, concentrated, waste-heavy blood during that window is a minute of elevated stress on aging tubular tissue. Warm lemon water begins closing that window immediately. It begins transitioning your kidneys from their overnight drought-stressed state to a properly supported, adequately hydrated operating state. The warmth of the water is not incidental. It is functional. It accelerates absorption, it soothes the gastrointestinal tract, and it makes it significantly easier to drink the full glass on an empty stomach first thing in the morning than cold water, which many people find uncomfortable before they have eaten. The preparation matters, and there are two common mistakes that eliminate most of the benefit before it reaches your kidneys. First, use a fresh lemon, not bottled lemon juice. Bottled lemon juice is typically pasteurized and often preserved, processes that significantly degrade the citrate content. The citrate in fresh lemon juice is measurably higher than in processed alternatives. Cut a fresh lemon in half. Squeeze 1/2 into your glass. That is your dose. The juice of half a lemon, which provides approximately 25 to 50 milligrams of citric acid, is the amount supported by the research. Second, use warm water, not cold and not boiling. Water that is comfortably warm, roughly the temperature of a warm bath, is absorbed faster, is gentler on the empty stomach, and does not degrade the citrate content the way boiling water would. Third, and this is critical, do not add sugar. Adding sugar to lemon water raises your blood glucose, which in turn increases urinary calcium concentration and promotes the exact crystal formation process you are drinking the lemon water to prevent. Plain, warm lemon water, nothing else. Drink it before your coffee, before your medications, before your breakfast, before anything else. The sequence matters because you want the citrate and the hydration to reach your kidneys while your urine is still at its most concentrated and most acidic, which is when both interventions are most needed. I know this is the question many of you are holding right now. Does this mean I have to give up my morning coffee? The answer is no. I am not asking you to give up your coffee. What I am asking you to do is add one thing before the coffee arrives. Coffee in moderate amounts, 1 to 2 cups per day, is not inherently harmful to kidney health in people without established kidney disease. Some research even suggests modest protective effects from regular coffee consumption. The issue is not the coffee itself. The issue is what comes before the coffee. When coffee is the first thing your kidneys receive in the morning, it acts as a mild diuretic, stimulating fluid excretion at exactly the moment when your kidneys most need incoming fluid. It extends the morning stress window. It prolongs the period of concentrated, acidic, waste-heavy urine flowing through your tubular system. And it delays the protective effect of proper hydration by another hour or two. One glass of warm lemon water before the coffee takes less than 3 minutes to prepare and less than 2 minutes to drink. It closes the morning stress window before the coffee opens it again, and it delivers citrate into your urinary system at precisely the moment it can do the most good. That is the entire change. Warm lemon water first, then your coffee, then your day. This morning drink is beneficial for virtually any adult over 60, but there are specific groups for whom it is particularly important. If you have a personal history of kidney stones, warm lemon water is not a wellness suggestion. It is a clinically recommended preventive strategy that should already be part of your daily routine. The National Kidney Foundation recommends it specifically for people with calcium oxalate stone history. If you have been told your kidney function is borderline, if your eGFR is anywhere below 75, if your creatinine has been trending upward over successive blood tests, morning hydration and specifically citrate intake in the morning are among the most impactful, low-cost interventions available to you. If you have diabetes or high blood pressure, both of which are leading causes of kidney damage, the morning stress window is even more consequential for you. Concentrated blood passing through kidneys that are already managing the effects of high glucose or elevated blood pressure is a compounding insult. Warm lemon water reduces the severity of that insult every single day. If you take medications in the morning, particularly diuretics, ACE inhibitors, or blood pressure medications, starting with warm lemon water before your medications helps ensure that your kidneys are beginning to move toward optimal hydration before the medications begin working. One important note: if you have established kidney disease at stage 3 or beyond, specifically if your nephrologist has placed you on a potassium restriction, please check with your physician before making any changes to your morning routine. Lemon juice contains potassium, and while the amount in half a lemon is small, your specific kidney function levels may require monitoring. The research on lemon water and kidney health extends beyond the morning window, though the morning is where the evidence for timing-specific benefit is strongest. A 2021 clinical trial published in eClinical Medicine examined urinary citrate levels and stone recurrence in patients who supplemented regularly with lemon juice compared to controls. The lemon juice group showed significantly elevated urinary citrate levels and a statistically significant reduction in stone recurrence over the study period. Research published in the Journal of Urology found that lemonade therapy, a clinical term for regular diluted lemon juice consumption, was an effective means of raising urinary citrate in patients with hypocitraturia, the medical term for abnormally low urinary citrate, a condition that significantly increases kidney stone risk. The evidence is not limited to stone prevention. The anti-inflammatory properties of citrus flavonoids, particularly hesperidin and diosmin present in lemon juice, have been studied for their effects on renal tubular inflammation. While this research is earlier stage than the citrate evidence, the direction is consistent. Regular consumption of fresh lemon juice appears to support the health of kidney tubular tissue over time. The one morning drink that stops kidney damage before it starts is warm lemon water. Half a fresh lemon squeezed into a glass of warm water, consumed before anything else every single morning. It works through 3 specific mechanisms. Citrate blocks calcium oxalate crystal formation in your kidney tubules at the exact moment of day when your urine is most concentrated and crystal formation is most likely to begin. The alkalizing effect of metabolized citric acid raises urinary pH and prevents uric acid stone formation. And the warm water itself begins closing the morning stress window, rehydrating your blood and reducing the filtration workload on aging kidney tissue. It costs a few cents per day, it takes less than 3 minutes to prepare, it requires no prescription, no specialist referral, and no special equipment beyond a glass and a fresh lemon. And it is something you can start tomorrow morning. That is the entire change. One drink, one sequence. Lemon water before coffee, every morning. I want to hear from you in the comments right now. What is the very first thing you drink every morning? Is it coffee, tea, water, juice, or something else? And has any doctor ever discussed morning hydration with you in the context of your kidney health? I read every comment, and the answers to those two questions tell me more about what my viewers actually need than any analytics ever could. Your answer may also help someone else watching this right now make a decision that protects their kidneys for years to come. If this video gave you something useful today, please share it with someone you know who is over 60 and has never once thought about what their kidneys are experiencing in the first 30 minutes of every morning. That share takes 10 seconds and may matter more than you realize. Subscribe if you want to continue this conversation. In the next video, I'm going to walk you through the other 4 morning drinks that carry published clinical research for kidney protection. Each one works through a different mechanism. Each one is inexpensive, simple, and available in any kitchen. You will not want to miss it.